Hi, today I'm here with Dr. Philip Bomily from Solon Orthodontics. You come in for a complimentary consultation, and for us, if it's the first time we're doing it, we're kind of like, I don't know what questions I should ask. So, what are the questions that I'm sure you have things that you give to parents, and then you kind of say, do you have any questions? What are the ones that you wish parents asked you?
Yeah, it's all kinds of things related to how to deal with life with braces on. The three questions that they're mostly looking for when they come in are, what sort of treatment might be involved, how long will it take, and then about insurances and costs, those kind of things. Those are the three kind of standard ones that they really are looking for when they come in for a consult. However, you also you want to make sure they know, like, okay, what they're getting into, right? So what it's like with life with braces on, what sort of foods should be avoided, how should you alter, maybe not so much what you're eating, there's some of that, but more of how you're eating it. A good case in point is carrots. Maybe instead of eating raw carrots right there, which are really hard, they're great for you and we don't discourage that. However, you may want to have shredded carrots or cooked carrots, things that are softer or just a different, uh, texture, or not as hard, those kind of things, so that you can still eat those items, but just maybe not the way you used to without braces on. So those kind of things, just make sure they know what they're getting into. Um, what we always go over options. Invisalign isn't always a treatment option, but sometimes it is. So a lot of folks do know about that. There are a lot of times they come in kind of looking for Invisalign per se, and then they say, well, you gotta really, though, the best way to do your treatment is maybe with braces. It just depends on what the case presents as and what sort of tooth movements are necessary. Um, but again, just things of kind of gauging their comfort level with the practice, and where they're going to be going for the next quite some time, if you will, and just so that they're comfortable with their ultimate decisions, like you said.
Do most orthodontists offer both the traditional braces and Invisalign?
It's a hard question for me to answer, but I think that most people do. I can't speak again for everybody, but I think Invisalign is well, clearly it's here to stay, and other, I shouldn't say Invisalign specifically, but that and other clear aligner methods, because there are other ones out there. I think it's definitely something that people are looking for these days, and it can be definitely an effective way to move teeth, and certainly a very aesthetic way. And there's certainly some advantages to it. So, folks that aren't doing that, I'd say, well, gee, probably should look into it a little bit. But again, it's comfort level. If you're comfortable working with one sort of a tool, if you will, from the standpoint of tooth movement, and you're comfortable with the braces, and you're not comfortable with that, well, then I guess it's better than doing it when you're uncomfortable with it. But sometimes you got to get into it and get comfortable with it one way or the other, because I mean, clearly it's here to stay, and I think it'd be wise to do that.
Yeah, it's the wave of the future. So if you go to a dentist that doesn't do it, I'd be pausing. Like, why? I mean, an orthodontist. Oh, which brings me to the next question.
Yep.
Dentists are offering that now. Is there a particular art to this that we should be cautious about doing it with our dentist and not going to an orthodontist?
Well, again, I think it has to do with your comfort and trust level with your specific provider. Just because, I mean, look, we got to be a specific orthodontist, you get at least 2 years, sometimes 2.5 or 3, depending on the residency program, of additional training in orthodontics only. Um, However, there's definitely situations that I know general dentists that do a nice job with certain things like Invisalign and such. So you just have to kind of see what you're most comfortable with. Um, you know, it's the kind of thing where just because somebody can do it, does that mean they should do it? Not necessarily, but again, um, you really have to kind of ask yourself: is that something you want? General dentist doing, or do you want to go to the specialist for that? It's again hard for me to answer. I figure if I have a heart problem, I'm going to my cardiologist, not my normal doc first, maybe, but then the cardiologist. But again, you as the consumer have to be comfortable with that. I think I would think it's fair to say that working with a dentist is far better than some of these direct to consumer products that are available out there right now. Where that's a little concerning because you're like nobody's really overseeing that. So that's a concern that we as dental professionals have just in general, that people are accessing those, and there's definitely interest in it, but that can be a dangerous proposition. So at the very least, you've got at least a dental professional looking over if you have a general dentist working on you. So that's far better than.
Okay, I want to go back to that complimentary consultation that you have. And this is more of a parenting question than it is an orthodontic question. So the parent comes in, and I assume the parent is prepared to ask you a bunch of questions. Um, do you encourage, do you like when the parents encourage the kids to ask questions? Do you also do a like shifting of your head to ask the kid if they have any questions?
Absolutely. I mean, because if the kid's the patient, by all means, they need to know what they're getting into as well, not simply their parents.
Okay, so when I spoke to you before getting ready for the interview, you mentioned to me that it's your goal to create a very positive experience from beginning to end. And I did speak to people who work for you, and I can tell that you're doing a great job at that, that there really is just a very child-centered approach to walking in, and the way you treat everybody that comes in the door. So I wanted to set this out as kind of a like what we should all be looking for. What do you do? What does that look like?
Sure. Well, I would start by saying, it's more patient centered than child centered. We do take care of all age ranges. There's no, limitations there. I'm, very happy to work with anybody, not just children. But basically, it's all about them, right? It's not so much about us. It's about how we're doing things here so that we can make their, braces experience a fantastic one, so that when they're done, they can look back sort of fondly on that experience and say, gee, that was great. They treated us, very nicely. They treated us like members of their own family. If we ever had a problem or anything like that, we saw them as soon as we possibly could. We'd do things above and beyond. You stay late if you have to take care of somebody so they're not uncomfortable for the weekend, and on a Friday evening or something like that. You come in on a weekend day one time to clip a wire to get them comfortable for the weekend. Those kind of things. Again, because they want to be taken care of. They need to be taken care of. They're as much, or they may know about orthodontics. Maybe they had braces as a kid, if it's a parent, and now they're bringing their child in. Yeah, they may know some stuff about braces, but at the end of the day, you're the ones leading them around and shepherding them and through that experience. And so they need to be just comfortable with you in a comfortable setting, in a comfortable environment. We've designed our office to be that way. Just a place you come in with, calming colors, just a night, just a nice, again, comfortable feeling that just makes it feel like they're in a living room, or if they're in the, kind of patient lounge area.
Okay, well, so Dr. Bomley does not like to talk about himself. So I asked someone that works for him to talk about him. And what I want to tell you is, which I'm sure you can tell already, he's the reason that the office is a nice place, because he sets the tone. And the people that he hires also have the same philosophy. So from beginning to end, you will feel respected. Your kid will feel respected if your kid is the person he's working with. And so just overall, an environment that I think we should all expect, but don't always get. So thank you for that. And then I want to ask you, there are kids who struggle in life in general, that going to the orthodontist would be more challenging. They have sensory issues. They're phobic about things. They might be on the spectrum. Is that something that you handle? You have protocol for it?
Yeah, and it's just even like one more step further than we do for anybody else. We actually have a brand new office we just got into about a month ago now. When we designed this place, we now have 3 private treatment rooms, and that can be nice sometimes. A little quieter area for somebody who may have some sensory issues, those kind of things. But at the end of the day, it's all about, again, speaking that person's language. If it means going slower, if it means separating out things and appointments that we might do in one appointment, in certain circumstances, maybe it's 2 appointments, and you just do a little bit, and you don't want to overwhelm the patient at any point in time. So maybe you make appointments longer. Maybe you make them in times of the day that are a little bit less crazy busy. Those kind of things to help that person feel more comfortable with the treatment that they deserve.
Do you see their bodies relax? Like you can tell that made a difference?
Yes, absolutely. And I think that that's also borne out by the parents saying too, like, wow, you guys are just great with how you're handling things, and they're appreciating the effort that we're putting into it as well.
How long are they supposed to wear the retainers when they're done?
Yeah, the thing that we found in the last couple of decades is that the teeth will always want to move, and so the unfortunate thing is we can't ever say that there's a time that we're comfortable completely discontinuing retainer wear. Everybody does things a bit differently in their offices. What we do for a good bit of our patients is like to do some gluten retainers on the inside of the top front four teeth and the bottom front six teeth, and then we make some removable retainers that are clear that we just ask the patient to wear at nighttime. We recommend leaving the gluten retainers for at least 2 years. After that, if they want those off or their dentist wants them off, because sometimes that's the case, and that's perfectly fine. After 2 years, we'll take them off, and now they just have those removable retainers to wear at nighttime. But again, the recommendation is to never discontinue that nightly wear. Otherwise, all bets are off. The teeth can move. And, we see it all the time. We get patients come back, they haven't seen us in a couple years. They come on back and we say, hey, how's your retainers? And, I haven't worn those in a couple years. And they say, but my teeth look, doc, they moved. Yeah, they did move.
Okay, what's the relationship between the dentist and the orthodontist?
Teammates, right? You've got to be on the same team. We, pretty much every patient that we see, or most of, sometimes when they come to us, they maybe just moved and they don't have an established general dentist yet. But most folks that we're seeing have a general dentist. If they don't, I make sure that they see a general dentist before we're comfortable starting treatment on them, because I want to make sure that they start off with a clean slate. There's no you know cavities. There's nothing that's a concern from a general dental perspective before we start moving their teeth around. So they certainly will by the time we get started. um, but again, we're teammates, right? Like I have to help them do what they're trying to do, and vice versa. We got to be on the same plan.
Last question. What are you most proud of with your practice?
That the trust that we've earned and gained with patients and their families and the community just is, you can't, it takes a while to get that. And that's what makes me proud when we have families coming back and recommending their friends, other family members. People trust us. Thank
Dr. Philip Bomley from Solon Orthodontics, thank you so much for being here with us.
you for having me. I appreciate it.